The EINC, or the Essential Intrapartum Newborn Care Practices, are evidence-based standard for safe and quality nursing care for birthing mother and her newborn. The, the EINC protocol is being mandated by the Department of Health under Secretary Francisco Duque way back December 2009. The EINC protocol is mandated to promote and improve maternal and child health and to lessen the number of maternal and child health mortality. The purpose of EINC practices is to provide safe and quality nursing care for birthing mother and their newborn, to perform the recommended practices during the intrapartum and immediate postpartum period, and to follow the recommended practices for the newborn care prior to woman to deliver the newborn. Good morning, ma'am. I am Andre, your assigned student nurse for today. I am here to help and guide you before delivering your baby. Ma'am, may I ask you for a few questions? Thank you, ma'am. Ma'am, are you comfortable on your position right now? Thank you, ma'am. Do you wish to eat or drink any food? Thank you, ma'am. In giving food and water to our pregnant mother before their delivery is not advisable. Why? Because dahil itatay din po ng mother yung kakainin niyang pagkain kapag during yung panganak niya po. So, it's not advisable. Ma'am, upon checking your EI a while ago, your uterus is not yet fully dilated. It is only 7 cm. Let's wait for a while for your uterus to become fully dilated po. And ma'am, just relax and calm yourself.
Ready the DR and preparing for the delivery. Check the room temperature or the DR temperature. It should be 25 to 28 degrees Celsius and eliminate air drop. To check the elimination of air drop, I have a piece of paper here. When I drop the piece of paper, it should be fall straight to the ground. That's the sign that the room has no air or there's no presence of air drop. If the paper flows in the other way, it means that you need to check and close all the windows and door. Okay? So the paper falls straight to the ground. Let's now check our client's comfort. Ma'am, are you comfortable on your position right now? Are you comfortable in the semi-upright position? Thank you, ma'am. The semi-upright position is the default position in the delivery table. Remove all your jewelries if you have, and perform hand washing. Observe the WHO 1, 2, 3, 4, and 5 procedure. So I am going to do my hand washing. Newborn resuscitation area. Check if they are clean, functional, and easy to reach. Arrange them in a linear sequence. So I have here gloves, dry linen, oxytocin injection, bonnet, cord clamp, equipment clamp, scissor, and 2 kidney basins. In separate sequence, after the first breastfeed, I have
eye ointment, vitamin K, hepatitis B, and BCG vaccine, plus cotton balls and other equipment.
After cleaning the perineum, wash hands and put in 2 sterile gloves if you're going to handle the perineum and cord.
At the time of the delivery, encourage the mother to push as desired. Okay, ma'am, just calm down and relax yourself. Inhale, exhale, and push. Inhale, exhale, and push. Inhale, exhale, and push. Okay, ma'am? Drop a dry clean linen across the mother abdomen and arm, preparing for the drying of the baby. Apply parental support and control of delivery of the head. Baby girl out, 3:40 in the afternoon. Ma'am, your baby is a baby girl, and she is very healthy and adorable.
For 30 seconds, thoroughly dry the baby, starting at the baby's head, down to the baby trunk, and to her extremities. While drying the baby, perform quick check. Remove the wet cloth and place the baby into the skin-to-skin contact in the mother's abdomen and chest. Cover the baby with a dry, clean linen and bonnet. The benefit of skin-to-skin contact is for mother and child bonding and bless. Breastfeeding success, lymphoid tissue system stimulation, exposure to maternal skin flora, sugar for protection for hypoglycemia, and thermoregulation.
To the second baby by palpating the abdomen and preparing for the giving of oxytocin. After one minute of the baby is being delivered, give the mother the oxytocin or inject the oxytocin. Remove the first gloves and decontaminate them on a 0.5 decontamination solution for at least 10 minutes. Palpate the umbilical cord for at least 1 to 3 minutes. When the pulsation stops, apply a plastic umbilical cord 2 cm from the umbilical base. And apply the second umbilical cord 3 cm from the first umbilical cord or 5 cm from the umbilical base. I don't have my second umbilical cord, so I will use the umbilical cord equipment. And cut the umbilical cord near the first cord or near the first umbilical cord clamp. Perform the remaining step of the active management for the third stage of labor. Wait for the strong uterine contraction and then the strong umbilical cord contraction and the counter contraction of the urine until the delivery of the placenta. Massage the uterus until it's firm. Inspect the lower vagina and perineum for laceration and prepare for the laceration, tears, or as necessary.
Examine the placenta for the abnormalities and completeness. So far, the placenta is complete. It means that there is no abnormalities and the placenta is shallow. Clean the mother by flush the perineum and apply pad, napkin, or cloth. Check the baby's color and breathing. The baby's color is normal. The baby's breathing is normal. Check the mother for her comfort. And check for the uterus contraction. Dispose the placenta in a liquid container or plastic bag. And decontaminate all the liquid pen before cleaning. And decontaminate the second gloves for at least 10 minutes on a 0.5 decontamination solution.
Advise mother to observe for feeding cues. Ma'am, please observe your child for feeding cues. These are turning her head, rooting and seeking, opening her mouth, sucking her thumb, and crying for the last sign of hunger. Instruct mother for positioning and attachment. Wait for full breastfeed to be complete. After a breastfeed, administer eye ointment. Eye ointment is for the prevention of gonorrhea. After a complete physical examination, administer vaccine. These vaccines are vitamin K, hepatitis B, and BCG vaccine. Vitamin K to prevent blood clotting. Hepatitis B to prevent some liver disease or to prevent disease that connected from liver. And last, BCG vaccine.
Advise delayed or optional bathing, but bathing is done usually after 6 hours. Advise breastfeeding per demand. Ma'am, whenever your baby wants to breastfeed, please breastfeed her. For the first 1 hour, assess or check your patient. For the baby, for the color and everything. For the mother, for the vital signs. And for the next second hour, check your mother and baby every 30 minutes to 1 hour. Complete all the documents.